that. There we go. Alrighty. Okay. So, hey, Latasha.
Hey, how are you doing?
I'm good. Thank you so much for joining me today.
Yes.
So, my name is Natasha. I am a registered nurse and nurse entrepreneur. I'm the owner of IKRN, which is a care management company. I partner with physicians and nurse practitioners to deliver care management services to their eligible patients who are living with chronic health conditions. I have partnered with other CCM nurses, nurse business owners, and created a course that teaches other nurses how they can start their own chronic care management business and monetize their years of nursing knowledge. As nurse care managers, we help patients and their families plan for their healthcare needs and ensure that they have access to community resources that are available to them. We help with appointment scheduling, medication review and refills, care coordination, and so much more. Today, I will be talking with Latasha Laird, who is a CCM business owner, has worked as a care manager, and is one of the course instructors for our CCM for Nurses course. Latasha teaches us about business implementation and setup. So Latasha, tell us about yourself and your background.
Hey, Natasha. Thank you so much for having me. As Natasha stated, I am Latasha. I am a registered nurse. My background is case management. I have a CCM agency, and I also have a CCM back office agency also, where I help other CCM agency owners with their back office. Like Natasha said, I talk a lot of I talk a lot of business aspects in the CCM agency in actual implementation, because that is what a lot of us have problems with, is actually implementing what we learn. A lot of us, know the program basically front and back, but when it's time to implement and know those business structures, that business formation, and I'm not talking about like formation with your Secretary of State or the IRS, but like your actual structure and foundation of your business, that's where a lot of us really lack the knowledge and where we fail at. So back office is my passion. With back office, not only do I do it in healthcare, but I do it in trucking too, because that's just a need. So naturally, I gravitated to back office with the CCM agency also.
Okay. All right. So what is chronic care management? So chronic care management, or CCM, is a program that was started back in 2015 by Medicare. It is a service that's provided to individuals who are living with 2 or more chronic health conditions, such as heart disease, diabetes, lung disease, or other condition that places the individual at risk of complications, death, deterioration, exacerbation. It is primarily provided virtually outside of the medical office visit, and provides individuals with a trained care manager who serves as the point of contact between the patient and the medical practice. This helps to ensure that all the patient's healthcare needs are met and addressed and managed effectively. So Latasha, what made you decide to get into CCM and start a business as a CCM nurse business owner?
Yeah, so I actually got into it by, I would kind of say, well, the business side of it by accident. So my background is case management, both hospital and insurance company. And with the hospital, it was a teaching hospital. And so we would have residents. The residents are basically still in school. And so when those residents transitioned out, they would actually contact me to ask them for help with different case management things for their patients. So I was actually doing it for free. So I have a staffing agency, and my staffing agency's niche is case management. And someone actually told me about the CCM program. And so I did my research, and I was like, well, I'm doing this, for free right now. I
Mm,
know that there is definitely a need in my community for it. I live in Mississippi,
mhm.
and it's definitely health disparities here, and it can be CCM can definitely be used. Hence, my old residents would contact me to assist them with case management needs for their patients. So I did my research on it, and I went ahead and started implementing it. And those residents were my first client. So it was, a win-win for everyone. I
Right.
got to start getting paid for what I was doing. Of course, the patients started, well, they were already getting help, but they got the assistance that they needed, and we could actually document that assistance and stuff because, technically I wasn't a part of the residents, I wasn't one of their employees, so I couldn't go in there, document what was done or anything like that. But once we actually implemented everything, now everyone can get credit for it, and those providers can now get that residual income from implementing CCM into their office.
Yes, yes. So I got in, I've been a nurse for 20 years. And so I worked as a medical receptionist, I worked as an insurance biller before I became a nurse. And so what I found CCM, and of course, like Latasha, I did my research and I was like, well, this is what I've been doing throughout my nursing career. I can do this with my eyes closed. I know how to educate patients. I know how to talk with them about their diseases and follow up, review their charts to see, hey, what's going on? Something's missing here. Maybe a lab wasn't done or something. So I knew that this was something that I could do. And then I also knew that, I know minority communities are affected more with chronic health conditions. And I was like, I wanted to do something to help my community. And this I found was something that was really, easy to do, not a whole lot for the startup cost. And it would help people. And of course, I would be able to generate income for myself and also help the providers generate income for themselves. So that is how I got started. And then I met with Latasha and of course Mignon and Quinta. And so we got together and developed a course. So let's talk about how can nurses benefit from starting their own CCM business, Latasha. Can you tell me how you think a nurse
Whew.
can benefit from that?
Yes. So there are so many benefits to starting a CCM agency. And like you stated, it's things that we're doing anyway, things that we are absolutely doing anyway. Um, Nursing is nursing, care management is care management, no matter what setting you're doing it in. And sometimes we just need to erase the word care management or case management because that kind of it's like it confuses nurses.
Mm,
Basically, you're providing nursing care over the phone. That's what you're doing.
yeah.
You're doing your assessments. You're helping that patient and the caregivers with whatever it is they need. The only difference is you're not physically with them.
Okay.
So the case management, care management is just the name that goes with it, but it's nursing care that you do all the time, and it doesn't matter what area you're in. You do case management whether you work on the floor, whether you work in a clinic, whether you work in an outpatient section, even if you work in surgery, you're doing case management because you have to ensure that that patient has the appropriate caregiver upon discharge. Like you are doing case management things, you're providing education to that patient, you're providing education to that caregiver. So you're doing case management, care management all the time. You just don't call it that.
Mhm.
And so one of the benefits, the nurses, we just have to learn the actual program itself, as in like the Medicare guidelines. You
Mhm.
don't have to learn how to be a nurse. You already know that. So
Right.
that's one benefit. You
Mhm.
don't have to basically relearn a skill set. You don't have to relearn that. The
Right.
other is the flexibility of it.
Mhm.
So we'll just use basic. 20 minutes of time, and most of the programs can be billed up to an hour a
Mhm,
month, just very basic. So
mhm,
an hour a month, it doesn't mean you have to talk to that patient, for an hour.
right.
You could be doing care coordination things for them. You can be checking, like you said, medication reviews.
Mhm,
You have to do a care plan. All those things take time. So you getting up to that hour is
mhm,
not hard at all.
right.
You might talk to the patient 5 minutes, but you can spend that other time doing other things. And it's not an hour or 20-minute increments in one setting. You
Right.
have literally the calendar month to
Mhm,
complete that hour. And
right.
I keep on saying hour because that's usually what it'll take you for that patient, but it's 20-minute increments. So if you want to be technical, 20-minute increment. It doesn't have to be done in one setting. You can do 5 minutes today,
Mhm,
another 10 minutes next week, and then the other 5 minutes, the following week, all within October.
right.
And that actually is your increment, your 20-minute increment.
Mhm,
So it is very, very flexible. As most of you all know, I'm usually in my car all the time that I get on live.
mhm,
And that's because I have so many duties. I'm a wife and mom first. So CCM actually allows me that flexibility. I can schedule my calls, I can schedule the calls with the doctors.
mhm,
However I need to do it, I can do that.
mhm.
So that's one major benefit. And then you get to be your own boss.
Yep. Yeah.
Being your own boss to me is just unmatched.
Mhm,
I don't have to call anybody and say, well, my daughter has this going on, or my son has this going on, or I just don't feel like coming.
right.
I can, do it, on my own. But I do know that entrepreneurship is not for everyone. And
Right.
that's why you can offer to be a consultant to provider offices to help them implement the program. So
Yes.
you have so many different routes that you can actually take with CCM. And like I said, you don't have to learn a new skill set. You already got the skills of how to be a nurse.
Right.
You just got to learn the guidelines and start implementing it. It's so flexible. It's low startup costs,
Yeah.
extremely low startup costs.
Yeah. It
You
is.
already got everything that you need to get started. You got a phone, most likely you got a computer,
Mhm,
and you most likely have internet or hotspot. So you have what you need to get started. And
mhm,
depending on your patient load, you might not even need a full documentation software starting out. Some of the stuff you can do on your own,
right.
but you have, so much that CCM can offer and so many benefits to nurses doing it. You have software companies out here offering CCM.
Mhm,
Most of them are
right.
non-clinical,
Exactly.
but they are offering these CCM programs. And it's like, hey, why not us nurses do this? We
Right.
should be able to do this, and we can.
Yep. Yeah. So definitely, like the benefits, as Latasha was saying, is one, we don't need any certification for this. We already have the knowledge. It's easy to get started. And then of course there's the monetary benefits as well, because you do generate that income. You can do it as something at the side to start with, and then as you start to grow and scale, you determine how much you want to make, and then you focus on getting to that point as you grow and scale your business. So what does a care manager do? So a care manager, we usually provide the individual with 24/7 access to the support that they need between the doctor's office visits, which allows them to, maintain their health. We help them with medication refills, coordinating their care between multiple providers. We create a personalized care plan for them, educate them on the disease, and we empower them with the information that they need to maintain good health. So as nurses, we advocate for the individual as part of the healthcare team. So Latasha, tell me about what a day in the life of a CCM care manager looks like for you. How do you
Yes.
answer it?
So a day in the life, it's basically a pretty straightforward day unless I have a patient that's having true issues. As you guys know, like the last couple of months here, I live in the close to the Jackson, Mississippi area, but most of my patients are in Jackson, and we have a water crisis right now. And a couple of months ago, they had a bad flood. So those days were kind of hectic because I was hauling, water around, trying to, check on residents to make sure they had what they needed. So those days were pretty hectic. And you will have those days if things happen. As a case manager, you want to make sure that your patients are able to get whatever it is that they need. But outside of that, a typical day is literally just me contacting the patients that I have scheduled for that day. And most of the patients, they'll let you know, hey, I want to be called on Tuesdays. Don't call me before 10 a.m. So I go by, whatever day and time, they want me to call them. So I'll contact them, and usually their intake is already done. And what their intake is basically when I onboard them to the CCM program. So when I'm calling them, we're discussing their care plan, going over, because the care plans are patient centered. Right. So we're going over their care plan, and it's basically what they want to talk about. Now, I do check on their medications, make sure they're taking everything appropriately. Whatever their diagnosis is, I do address things in regards to that. So if they have hypertension, I ask them, because most of them are not on RPM because the devices would come up missing or something with those devices. Yeah. So only very few are on RPM, but that's a whole nother story. Right. But they, I'll check on them just to see how they're doing, any needs that they might have, check to see if they have had any appointments since the last time I spoke with them. And if basically nothing has changed, I will update their care plan. And I'll look at their medications to see if it's a medication reconciliation needed. And I personally like to get medication reconciliations every month. And that's just my personal thing. And that's just something that I learned from working as a case manager in the insurance sector. So I just brought it over to my own company, basically. I update the providers on anything that is needed. Most of the providers give me free range to do whatever it is I need to do, but I go ahead and update them. Medicare requires you to notify I wouldn't say notify. They require the provider to be up to date on those care plans and basically anything going on with that patient. So I always make sure that that provider's office has the updated care plan. And so that's my typical day. Sometimes I might call the pharmacy to do those medication reconciliations. I help with prior authorizations. So, and that's all billable time. That's the good thing. Right. Exactly. So that time I'm spent, with the insurance company is mostly the Advantage plans. But those times that I'm spent, with the insurance company trying to get a PA for a medication or equipment, all that is billable time. So that's typically, my day is usually just spent being a nurse over the phone, right, and just secretary stuff, really. CCM is not a hard job once you get your patients. Right. You do have times, like I said, we have that crisis going on. But that's not going to be, forever, and that will not be your typical day, day in the life of a CCM nurse. But it's very, relaxing. It's very relaxing. Now, when it's time for the end of the month, when it's time for billing, that does get a little hectic because you have to go pull the billing reports and send it off to providers. But a regular just CCM nurse is pretty smooth.
Right. Okay, well, I just want to say thank you for being such an amazing person, nurse and care manager, and reinforcing for me why I believe that nurses should be care managers. Because like you said, there was the crisis that you had there, and you were out there. You were out there checking on your patients, checking to see if they had water. You were letting them know where the water sites were that they can go and all of that in the community. So I just want to applaud you for that. I was like, wow,
Thank you. Thank you.
that was just really amazing.
Yeah, yes. It's definitely needed. And when you think about the provider offices, most of the people that work at the provider office is not from their area. So they don't know what's going on out in the community. So like the patients would contact them, but they really weren't able to offer a lot of help to them, assistance or anything like that, because they're not experiencing the crisis. Like the crisis didn't directly affect me since I wasn't, in the city, but it affected my loved ones and stuff. It affected my, residents, my patients. So, I had to, figure it out. I had to, check on what's going on with them, making sure like if they don't have clean water, how are they going to take their medications?
Right.
How they're going to clean their wounds? Just how are they going to cook? Like it was, horrible. Like some people literally had brown water coming out the faucet. So yeah, those situations like that, and you have to think about it. Most of the elderly population, they don't have cars or anything to drive. So how are they to get some clean water? And so like it was horrible, but it's easing up now, and that's the good part.
Good. So how do we get paid as care managers for delivering the service to the patients? Normally, we would contract with a provider and we would enroll those patients. And then, of course, we would bill that provider for the service that we provided to the patients at the end of the month and then get reimbursed directly from the provider. We do not bill Medicare directly. Another question I'm often asked is who can provide the chronic care management services? So registered nurses, LPNs, in some cases, health coaches, medical assistants. They can definitely provide the care management services, but of course, you want to ensure that you follow up with your state and ensure that you are following your state guidelines and ensuring that you're functioning within your scope of practice, especially as it relates to developing the care plan, because in most states, I'm not sure if it's throughout the United States, only registered nurses, well, LPNs are not allowed to create and develop a comprehensive care plan, but they can certainly help gather the information. And so I always advise everyone to just follow your state guidelines to see if you are able to, but RNs, LPNs can certainly start their own chronic care management business. So another question I wanted to know, tell me a bit more about your onboarding for the provider and how do you do tell me a little bit about your back office stuff.
Yeah. So the onboarding for the provider, basically every provider is going to be different with their onboarding. So I'll give people background on when I started. So my residents, I tell people that wasn't the real world at all.
Right.
I just literally told them XYZ and they did XYZ. I told them, okay, this is how much I'm going to charge. They said, okay.
Right.
So that does not happen. I didn't even have any software, literally. They had Epic. And so at first we were just charting inside of Epic. And then about a month into it, we found out that Epic actually has an add-on for that does the CCM stuff. And I didn't pay for nothing. Like it was, when I tell you it was sweet, it was sweet. But like I said, that was not the real world. I got a shocker when I got into the real world. So I would tell my journey in some of the groups on live about some of the provider offices that gave me a hard time. And so you would go back and forth on the contract. Okay, so of course we know that we can't speak in percentages. When we're speaking with the provider, we got to give them that flat rate. But for us, I thought I was going to get my 70-30. No, the providers, they do not want to do 70-30. Most of them don't want to do 60-40 unless the 60 is in their favor. Like negotiating that part was hard. Negotiating the part of the net terms on when they would pay me, that was hard. Like we would go back and forth, back and forth, back and forth. because most of the providers' concern was, well, I'm paying you before I get paid for Medicare. So how do I know that I'm going to, get paid for Medicare?
Mhm.
So now I actually just have a net 28 term just to eliminate that.
Mhm.
But just with those circumstances right there, each of those provider offices onboarding were different. So a
Mhm.
typical onboarding is once they sign that contract, get that contract finalized, do
Mhm.
not schedule an onboarding until you got that contract back. I
Right.
have been in the parking lot for onboarding and that contract was not signed.
Right.
And that contract did not get signed.
Mhm.
So don't waste your time scheduling an onboarding until they actually sign that contract, because that was a waste of my time. So
Right.
but once you actually get that contract and are ready to sign, what your onboarding is going to look like is, and for me, I tell the provider, I am here to help you.
Mhm.
What can I do to make it easy for you? If
Right.
you want me to call in med refills, that's perfectly fine. If
Mhm.
you don't want me to call in med refills, that's perfectly fine too. I
Fine.
basically get all the tasks that
Mhm.
they actually need me to help them with.
Mhm.
And remember, we're an extension of them, and everything that we're doing is billable time.
Right.
Billable time. And let's just say a patient is on CCM, but you are over that hour time frame. That's
Mhm.
fine, because most likely the reason why you're over that hour time frame is because they have some complex decision making that is needed, which will bump them up to complex. So
Mhm.
now you got an hour and a half that you can work with.
Right.
So we basically go over the tasks that they actually need me to do.
Right.
We go over the billing again. I basically, if they have an in-house biller, I
Mhm.
give that biller a cheat sheet with the codes on there, and
Right.
basically saying, okay, this is how many times you can bill this code. Just basically giving them a little small CCM billing breakdown so
Mhm.
they can understand the program.
Right.
We get from the provider's office, who are my contact people? Will I be speaking to the doctor directly? Will I be speaking with the nurse? And believe it or not, most doctor offices around here don't even have nurses anymore. They have medical assistants.
Yep.
The doctors around here are very cheap. They're very so if they can save some money, they will.
Right.
But a lot of them are actually ran by the medical assistants and the office managers. So we need to know who's going to be our point of contact. We
Right.
need to know what we need to contact them for. And
Mhm.
I personally like to have monthly meetings with the office to discuss those patients that are on CCM. Because remember, Medicare still, even though they're outsourcing the program, Medicare still requires them to be involved.
Right.
So
Yes.
they can't just say, here, do my CCM program and not know what's going on. So I like to try to have a monthly meeting just to go over the patients. And again, that is billable time. So that's the good thing. Anything
Good.
you have to do for that patient, billable time, just make sure you're documenting it.
Exactly. Exactly. We all know if it wasn't documented, it wasn't done. So.
Exactly. And with Medicare, you need to really put the times on there, because that is how you're getting paid based on those time increments. So we are going over, the basics of what we'll be doing, my point of contact. Of
Right.
course, we make sure that payment is understood.
Mhm.
And then we also determine how are we going to start, which patients are we going to start with first. So
Yeah.
I personally like to start with Medicare and Medicaid patients that have both. And
Right.
that is because here in my target area,
Mhm.
the patients, they can't afford
I think we just disconnected.
actually have those copays, and that could be, you know, do I pay for this, program, or do I get my medicine? or do I get something to eat? So I never want to put a patient in that position. So we always start with Medicare, Medicaid. We get those patients onboarded. And then we go down the list, Medicare, Medicaid, if they have Medigap. So Medicare, Medigap, those Advantage plans, and Medicare only is literally the last on the list, unless that provider says, hey, this patient really needs it. And so I check with that patient just to make sure that they will be able to afford the copay. And as we know, the copays vary per state and per how much Medicare actually reimburses. So I check with them just to make sure, but it's very rare that they say they can't handle it, because usually if they're on Medicare only, it's my population that I truly haven't targeted, like my so those people, you know, are able to afford it basically. And they usually, those people haven't stayed on case management long. It's usually because like their new diagnosis that they just need a little bit of help just to see how things are going. So, but my Medicare, Medicaid patients, they usually stay on case management for a while, and they, you know, they actually benefit from it. They have better outcomes having that one-on-one care.
Okay, great. So we're going to talk a little bit about our CCM for nurses course and what you were able to add to this course. So Latasha is one of the instructors for our CCM for nurses course. And so she was able to, add information on business implementation and structure. And as you can tell, she is very well versed in back office information as well. So Latasha is available for coaching and to help with the business implementation and setup once you've completed your CCM course, or you may have already started your CCM business, and some things you need help with the back office, and Latasha can certainly help you with that. Latasha, what's the best way for someone to reach out to you if they wanted to connect to kind of, get that part of their business started?
Yeah, so the best way to reach me for the back office, please don't direct message me, because sometimes it goes to like the request folder and I don't check it often. But my email is the best way. It's Latasha, that's LAT as in today, OSHA at proficienthsa.com. So that's actually the best way to reach me. Or you can go onto our website, proficienthealthcarestaffing.com, and you can put in a request there. Okay. But with the back office program that we offer, majority of the nurses, like I said, there's no new skill set that you need, but majority of the nurses do not know the business aspect of it. So they don't understand the marketing piece. They don't understand how to actually get their numbers. They might understand how to pull the numbers from the Medicare physician site to see what the reimbursement rates are, but they don't know how to really break down what they should charge. Yeah, you got the percentages, but how much of that are you actually making in profit? You got your overhead costs. You have to think about all those things. And so what we do with the back office, we basically, their business is already set up as far as registered with the state, the IRS, but we come in and we assist them with marketing. We do sales calls for them. We get their numbers together. They basically have an onboarding with us where we get their numbers. We get what they want their projections to be. We see if they're going to work it themselves, because if you're going to work it yourself, actually 160 patients is basically full time. I mean, you can do a little bit more, but I like to talk in billable hours. So 160 patients, and we like to go for billable time an hour. Okay, because if you're doing CCM right, well, case management right, you will get that hour every month. And remember, it's not all talk time. but we go off of billable hours, and 160 patients, that's 160 hours
Right.
a month. And that's your typical full-time job. A lot of people think, oh, I got to have these many contracts. Nope.
Right.
One contract will actually do you just fine.
Right. Yes.
Just fine, no matter what your, financial projections are.
Mhm.
And we break down whatever your target marketing audience is, whether
Mhm.
you just want to market to nurse practitioners or whether you just want to market to physicians. We all know, sadly, nurse practitioners don't get reimbursed at the same rate as physicians. So you need to know
Mhm.
what your numbers would look like if you are marketing to nurse practitioners,
Mhm.
because you will not give them the same flat rate
Right.
that you give your, MDs. Okay. So we go through literally all of that stuff with you. And at first I used to shy away from nurse practitioners. I would tell people, no, don't worry about marketing to them. But as I've journeyed into different states helping my back office clients,
Mhm.
nurse practitioners have actually been kind of the best clients because they really need that revenue.
Mhm.
And once you let them know, hey, it's passive income,
Right.
then they really like that. Just in small figures for if you're dealing with a nurse practitioner, I'm just going to use Mississippi numbers.
Mhm.
160 patients getting billable, that hour of billable time, you're going to bring in about $8,000 a month. And that's just off of Mississippi reimbursements and charging about close to 50%, like doing a 50-50 split with the nurse practitioner. And Mississippi rates are actually under the national reimbursement rates. So, like, there are other areas whose rates are, a couple of dollars, like sometimes some of them are about $6 more
Right.
than what we are reimbursed here in Mississippi. And so just here, 160 patients is all, and that's at 50-50, is almost $10,000, close to $10,000, like 8,000 and something.
Right.
But like that is, that's good money.
That's good money.
Most regular, nursing jobs are not making 8,000 a month.
Right. Exactly.
So,
Exactly.
yeah, so it's very good, it's very good money in it. And the main thing is your marketing, but you have to be consistent with it. Like, I have VAs to
Mhm.
make our cold calls,
Right.
and every week you have to contact those provider offices because they don't know you. First of all, they do not know you.
Right.
So in sales, it takes at least 8 reaches in
Mhm.
order to secure something.
Right.
And most of them are very interested in CCM once you actually put it out there to them. But your sales will be the most challenging thing, but you must stay persistent. You can't call somebody this week and then don't follow up with them until next month. You will never get any clients. You will never get any clients like that. You have to be consistent with those sales calls. Come up with some catchy marketing things. Don't spend a lot of money on marketing. Do not spend a lot of money on
Right.
marketing, but you can definitely come up with some email campaigns, fax campaigns. You can do things like that and send those out every week. Of course, they're going to start throwing them in the garbage starting off, but once you start sending them every week, they're like, oh, they sent something last week. Let me
Right.
read this. And
Mhm.
you have to get your business on their mind.
Yep.
That is a must. You got to get your business on their mind, because if you don't, it's going to take you forever to get a contract. And contracts, sometimes it can take 3 to 6 months. Sometimes, like
Yeah.
when I tell people, when I got into the real world, like, it was hard securing that contract. I had to be really, really consistent with it, and being with those residents that actually spoiled me. I didn't have to do anything.
Right.
And so when I got out there to the real world, those providers wanted to negotiate and everything. I was like, how dare you negotiate with me?
Yes, yes.
Right. How dare you not want to go ahead and sign right now?
Right.
Sign this contract, sign to these terms. But I mean, that's just what it is.
Yes, it is.
The marketing piece takes time, and
Mhm.
you have to be prepared for the no's,
Right.
and you have to be prepared for it to take a little while. We never know exactly how long it's going to be,
Right.
but just be whatever stage you're in,
Mhm.
just be persistent with it because it pays off. It is definitely needed.
Yes.
In Medicare's proposed ruling that came out in August,
Mhm.
one of the things that Medicare said was still, why aren't, and they're talking to providers, but why aren't you guys implementing CCM?
Mhm.
Like
Yep.
they want to know, why aren't you implementing this?
Right.
So Medicare wants to know, why is this program underutilized? So it's a great opportunity for nurses to market this. It's things that you do. And like Natasha said, you do not have to do it full time. You can do it part time if you want to. I offer trials for some providers, and some of the people in the back office, I talk to them about doing trials too. You can do 25 patients, 50 patients, you can even do 10 patients.
Right.
It just depends on, what you want your numbers to be.
Mhm.
You can do a couple just to get your feet wet. But it's so flexible, so flexible. And that's why I love it.
Mhm.
Because it's nursing care that you provide anyway. I can't stress that enough. You
Right.
provide this nursing care anyway. This is what you do. Now you'll just be doing it for yourself. And you can work as an independent contractor, independent consultant,
Mhm.
because the independent consultant realm is profitable. I'll just
It is certainly
honestly,
profitable.
yes, it is profitable because those providers, and like today, I did some number workups on a new back office client,
Mhm.
and I did the provider number workup,
Mhm.
and it was just for CCM and I believe BHI combined
Mhm.
at a 70-30 split. And I put this inside, the presentation for the doctors. And
Right.
if they want to go further, then we break their numbers all the way down.
Mhm.
But for a 70-30 split, the CCM agency, of course, getting 70%, the provider getting 30%. The providers would get a little bit over $100,000 in
Mhm.
income, passive income. And that's with only 100 patients doing CCM with those 3 billable events,
Mhm.
and then 50 of those 100 patients getting 2 BHI, general BHI billable
Right.
events. Over 100,000 in passive income at 30%.
Mhm.
Like that 100,000 is their 30%.
Yeah.
So just imagine if a provider says, well, I don't want you to run the program. I want you to help me set up the program.
Right.
You work your numbers on how much you're going to charge them off of their projected income. And it's every bit worth it, every
Right.
bit worth it. If
Mhm.
they're bringing in well over, if they're getting 100%,
Right.
they're bringing well over 200,000 a
Right.
year for those programs, and it will definitely be more than 100 patients. So whichever route you decide to go, whether you want to open up your own agency or whether you want to act as an independent consultant,
Mhm.
is definitely value in whichever route you decide to go.
Great, thank you so much. So we will be reopening our chronic care management for nurses course in November. We will announce in the group what day we will be releasing and reopening the course. And so we want to thank everyone for joining us today. You can certainly reach out to me if you have any questions about the course. And Latasha, certainly reach out to her via email or her website. Repeat your email and your website, please, Latasha. Repeat that so they can get that.
Yes. So my website is proficienthealthcarestaffing.com. And my email is Latasha at proficienthsa.com. And I will put the link inside the under the video in the Facebook group in case you all need to reach me. But please don't send me any DMs because I might not get it until a month later. And I don't want y'all to think I am ignoring y'all.
Okay, all right, great. And thank you everyone for joining us today. We will see you again. Thank you, Latasha.
Thank you. Bye-bye.